DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. Dr. Dan Thomson here. We're going to talk about something that you've heard all your life, the term red nose. Today we're going to talk about red nose, or IBR, infectious bovine rhinotracheitis virus. Right here on DocTalk, we're going to learn a little bit more about respiratory disease and so much more, so just stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning is brought to you by Profusion Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com. Valleyvet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop Valleyvet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson here at Iowa State University and a owner and partner in production animal consultation. Just very thankful that y'all are joining us. We're going to kick off 2022 talking about something that's very common in beef cattle production. We vaccinate for it all the time. Somebody'd say, did you vaccinate for red nose? And it is an extremely common disease worldwide. It causes if cattle aren't vaccinated, it causes very high morbidity, which means sickness, but not really high mortality unless we have a complicated case with a secondary infection like a bacteria. But red nose, or IBR, is infectious bovine rhinotracheitis virus. And IBR is one of those viruses that we don't see a lot because we vaccinate for it. So let's talk about the respiratory system in general first. Let's just back up a little bit. And the respiratory system has the function of exchanging gases, CO2 and oxygen. It is the way that animals vocalize. It regulates the blood pH and so much more. And really the respiratory system is broken up into two areas. There's the upper respiratory tract and the lower respiratory tract. The upper respiratory tract is from the air to the larynx. And so when we see from the nostrils to the sinuses to the pharynx to the larynx, and the larynx is the voice box, that's what we deem to be the kind of the upper respiratory tract. And lower respiratory tract would be once we get down into the lungs, away from the trachea to the bronchioles and into the pneumatic tissue of the lungs. One of the reasons why this is important is to understand is that when we have infections of the upper respiratory tract, we'll hear noise during inspiration. So breathing in, that's upper respiratory tract, and we hear noises in our animals. If we hear noises during expiration, or when the animal is breathing out, that means it's in the lower respiratory tract, meaning that grunt, and so understanding that inspiration noises is upper respiratory tract, expiration noises is lower respiratory tract, helps you be better at diagnosing what's going on within the animal. Now, within that respiratory system, once we go from the upper respiratory and we start to go down the trachea, One of the things that is really important to disease control and immunology for the animal is what we call mucociliary clearance. In the trachea, which is the windpipe or the pipe from the larynx to the lungs, there are little bitty hairs, cilia, okay? And the cilia are there to help clear mucus. So if you've ever, coughed up something or coughed up mucus, usually what happens is if you get dust or dirt or something and you breathe it in, obviously we blow our nose till it's clear, and the next day you get up and you hack up something that's dirt or dust. Well, as you inhale that, it gets trapped in the mucus, and the little hairs will bring that back up out of the respiratory tract so that you can get that expired or get that out of your body. Same thing happens with cattle. So mucociliary clearance is extremely important in helping prevent bacterial disease and other types of things from setting up and colonizing within the respiratory tract. So when we come back, we're going to talk a little bit more about red nose and IBR and how it affects the respiratory tract and pathology associated with bovine respiratory disease. You're watching DocTalk. If you missed Caregiver Camp this year, don't worry. We'll have more camps in 2022 at Thomson Ranch in Benkelman, Nebraska. The camp is an opportunity for new and veteran employees to receive one-on-one instruction in a relaxed environment from Dr. Tom Knopfsinger, Dr. Kip Lucasavage, and Ted Howard on cattle handling, horsemanship, animal health, disease detection, and team interaction. At Caregiver Camp, people learn how to grow, how to trust, and open lines of contact between animals and humans. These principles will allow you to build relationships with your own livestock and team. For more information and future dates, visit our events page at pacdvms.com.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Producers know stress costs money. It puts their cattle at greater risk of illness and can be a substantial drain on animal performance. That's why Zinpro developed ProFusion Drench for beef cattle. Formulated with Zinpro's patented trace mineral technology, ProFusion Drench is a no-script, no-needle performance supplement, proven to rapidly replenish essential nutrients lost during times of stress. For optimal results, use ProFusion Drench with Zinpro Performance Minerals in feed as part of a complete nutrition program. To learn more, go to zinpro.com. ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here, and we're talking about red nose and respiratory, bovine respiratory disease complex. And the reason why we call it a complex is because bovine respiratory disease is a factor of something that causes, remember there's two reasons why animals get sick, either an overwhelming dose of a pathogen or a suppressed immune system. And usually what we're dealing with bovine respiratory disease complex is a little bit of both. Animals are exposed to a new virus, they don't have a strong immune system because they're undergoing stress because of maternal separation, transport, shipping, commingling with new animals, so many different things that can cause this. And so when we get this commingling, and a lot of times people will blame our auction markets or blame the way that we buy and sell cattle, but really the fault is we need to get those calves vaccinated before they enter this commingling or before they are exposed to these viruses so that they have vaccination on board or have immune process on board to negate that type of thing. So IBR virus comes into the body, and the first thing it does is it sets up in the nasal passages, and then it'll go down into the trachea. And the reason why we mentioned IBR is because, and mucociliary clearance is because IBR virus will go in and it will actually damage the cells in the trachea that have the little hairs that provide the clearance. And so IBR comes in, it knocks out the hairs of the cilia of the trachea, and when that happens, the calf no longer has mucociliary clearance. So what happens is then after the viral infection, and we have no cilia to clear the mucus or things of that nature, that we have Mannheimia, Pasteurella, Histophilus, Mycoplasma are all bacteria that reside in the nasal cavity of the bovine steer. And once that we knock out mucociliary clearance, if those bacteria are inhaled and slide down the trachea, there's no way to clear that mucus. And so that allows for then, just because of gravity and things to that nature, and the lack of the ability to clear, it allows for the bacteria to colonize and set up and have secondary bacterial infection that comes after we see that initial viral. There's many different things that IBR can cause, and when we start to think about this, it's not just bovine respiratory disease, and I wanted to make sure that we touch on a few of those. IBR can cause bovine respiratory disease complex or kick-started. It can also be something that's immunosuppressive that kicks up in herds, and the last one that's mentioned probably the most globally is the ability for IBR to cause abortions in cows. So vaccinating our cow herd, pre-breeding shots, heifers, bulls, is really the key to control to IBR. It's a herpes virus. And you know, the old saying about herpes viruses, they don't go away. They're kind of like the persistent, it's not a persistent infection. What will happen with this herpes virus, or IBR, is once the animal clears the infection, the virus will actually go into the nerves of the face, the trigeminal nerves and different nerves of the face, and it will lay there in latency, meaning that it kind of hibernates. So once an animal has IBR, it has it for life. Herpes viruses are there for life. And so it lays there in those neurons in the face, and then later in life, maybe a cow gets stressed and all of a sudden she gets sick. Well, that can recrudesce or can come back out of those nerves, cause an IBR infection because of immunosuppression. And so it's one of those things that vaccination is key. We don't want to get the infections. When we come back, we're going to talk a little bit more about treatment. We're going to talk about prevention. You're watching DocTalk, and we're glad you joined us.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
Innovative low-stress cattle handling equipment is key to efficiency and safety. At Daniels Manufacturing Company, we design systems using the best materials. We work with top producers from all over the world who use Daniels products on their operations. We concentrate on quality, prioritizing the safety of the animals and their handlers. Each product is carefully crafted and inspected to ensure your system will last for many years. Whether your operation is small or large, Daniels Manufacturing Company can design a facility to meet your needs. Visit us online or call to see how we can improve your cattle handling facility.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here at Ames, Iowa, and I am a professor at Iowa State University and a veterinarian out in the feedlot community. When we talk about red nose, we've heard about that all the time, and my granddad always used to say, he was a veterinarian, and granddad said there are 3 vaccines that work: red nose, blackleg, and bangs. And he said, and bangs only work 67% of the time. I think we can throw BVD vaccines in there as well as being highly effective at preventing disease in cattle. But we vaccinate for IBR, and we don't see a lot of disease caused by IBR, because whenever we vaccinate with a killed vaccine or a modified live vaccine or an intranasal vaccine, we're vaccinating for infectious bovine rhinotracheitis, the herpes virus known as IBR or red nose. Now, I've been involved in a few cases of IBR, and usually when we see an IBR outbreak, it's due to we wean the calves early when we have a drought, and we wean them at 200 to 300 pounds, and they come in. There was maternal antibody interference on arrival, so when we vaccinated for IBR, the colostral antibodies, the passive immunity, inactivated our modified live vaccine and didn't allow it to create acquired immunity. And later on in the feeding period, we see these cattle. And the clinical signs a lot of times is you'll see, the reason why they call it red nose is you'll see, as in this picture, you'll see the redness on the nose, in the nares and the nostrils. We'll also start to see some foaming around the mouth. I've seen that in most of those cases. One of the other things is extremely watery eyes, and they run a very high temperature. Almost always with an IBR virus and case, we'll see 104, 105, 106 as temperatures. The incubation period from time of being exposed to the virus till you see clinical signs is 2 to 6 days, and it's relatively quickly neutralized in the body. The viremia caused by IBR only lasts 5 days. So really, when we talk about IBR infections, we're starting to get worried more about the secondary infections of the bacterial pneumonia than we are about the virus. When we necropsy animals that have died due to IBR, this is a pathognomonic lesion. And what pathognomonic means is if I see this lesion, we know it's this disease. And I used to love that when I was in veterinary school, because that was the easy one on the test, right? And so when we see an opaque opacity in the eye, or that white spot or pink spot in the middle of the eye, we know that's pink eye, right? Well, with IBR, when we open up the animal and we open up that trachea, and if you see this cheese-like substance that's adhered, it's not moving, okay, but it's adhered. You take your knife and you scrape on it and it's stuck. It's what we call a sewer pipe trachea. We know that's IBR virus, okay? So we know that's an IBR infection, and so when we scrape on that, that is pathognomonic in the respiratory tract for IBR. And so when we see it, we know what it is, and we can start to move on. Here are just some pictures looking at what IBR looks like and severe cases. For diagnostics, work with your veterinarian. The one thing you want to do is make sure you take some if you have live cattle, we'll take deep pharyngeal swabs, and you want to make sure you put those in the right media and then transport those to the diagnostic lab. A lot of times don't be surprised if they're negative, because there are times when that virus will be cleared extremely quickly, and now we had IBR, now we're moving on to the secondary infection. So again, work with your veterinarian, get a good diagnostic workup, and when we come back, we're going to talk a little bit about prevention and vaccinations for IBR.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Innovative low-stress cattle handling equipment is key to efficiency and safety. At Daniels Manufacturing Company, we design systems using the best materials. We work with top producers from all over the world who use Daniel's products on their operations. We concentrate on quality, prioritizing the safety of the animals and their handlers. Each product is carefully crafted and inspected to ensure your system will last for many years. Whether your operation is small or large, Daniel's Manufacturing Company can design a facility to meet your needs. Visit us online or call to see how we can improve your cattle handling facility.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertis on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here, and we're going to talk about red nose or IBR. So once you have an IBR outbreak and they're diagnosed, what are some of the things we can do? And one of the things that you can do is we can vaccinate in the face of an outbreak and revac with an IBR vaccine in a feedlot situation. But the big thing a lot of times is that viruses come. It spreads so rapidly through the pen that usually this is an immunosuppressive type activity. Now they've kind of naturally vaccinated themselves, so a lot of times when we revac them, we do it, but we don't know if we're doing any good or if we're just treating ourselves or treating the manager. The other one we'll focus on is the secondary infection, because once you have that viral infection, we have the knockout of the mucociliary clearance, we have the tendency to have secondary pneumonia, and so sometimes we'll run, to control BRD, we'll use chlorotetracycline or CTC Oreo in the feed for 5 days per label directions for control and treatment of disease. Or we might bring those animals in. Obviously, we're going to pull the cattle and treat them for respiratory disease. And the last one is sometimes maybe it is necessary for us to control disease through mass treatment of that pen to prevent the secondary infections. The real key to IBR is prevention. Vaccines work, and whether we vaccinate at branding, whether we vaccinate in our preconditioning shots, whether we vaccinate on arrival of bovine for IBR vaccines work. Now, there will be questions about modified live versus killed. We use a lot of modified live in the feedlot situation. We use modified live IBR almost all the time. And then when we get to a cow-calf situation on the ranch, make sure you work with your veterinarian on recommendations. Usually we'll use modified live on our pre-breeding for heifers and the 2 rounds of modified live. But once we have a pregnant animal, we don't recommend a modified live go into that animal. And so there are many different discussions. You have a medical expert in your community that works in herds in your area. Work with them, okay? Understand IBR and how to vaccinate and how to control for this. There are a lot of intranasal vaccines on the market today for IBR. And so if parental means injection, intranasal means the mist or the solution that we put in the nasal cavity. That's a modified live that'll replicate, create the immune response, and work. Most of the time when we use an intranasal vaccine, we're going to use that for baby calves early in life because the maternal antibody does not interfere with the intranasal vaccines. Once we get to a feedlot situation, we're almost always working with a injectable, modified live parental vaccine. There are some veterinarians that believe in killed, but if I had to break it down with IBR, if you're going to use an intranasal, that's usually for the baby calf the first week. If we're going to use feedlot calves and we're going to vaccinate them, we're going to use modified live. In our heifers and cows, we'll use modified live pre-breeding for the heifers, 2 doses, revaccinate 30 days before breeding. And then once those animals are pregnant, we never put a modified live vaccine in them. I hope you've enjoyed today. I enjoy taking these things that we take for granted, like red nose or IBR, and use those terms loosely in our industry and get a deeper understanding. If you want to know more about what we do at DocTalk, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. From Production Animal Consultation here in Ames, Iowa, I'm Dr. Dan Thomson, and I'll see you down the road.
Closed captioning is brought to you by Profusion Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zinpro.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals. ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.